today's video, I will be discussing Chapter 4, which is your endocrine, nutritional, and metabolic diseases from E00 to E89. So keep watching our videos, especially those previous videos that I have. We have your Chapter 1, Chapter 2, the General Coding Guidelines, and of course, you need to know the alphabetic index and the tabular list before moving on to your chapter specific guidelines. So guys, in these chapters, it's very important that you know the guidelines in this chapter because I am confident that they will going to ask a question about your chapter 4. Okay, so let's start your chapter specific coding guidelines, chapter 4. So your chapter 4, your endocrine, nutritional, and metabolic diseases. So let's start with the very first one, which is your diabetes mellitus. So your diabetes mellitus, there is approximately 23 or 24 million of Americans having a diabetes mellitus, and this is increasing yearly. And if this is common conditions that we may encounter as we go through the coding, definitely they love to ask questions about this because we need to know how to code them properly in order to report the appropriate code and in order to be paid with a maximum reimbursement. Okay, so your diabetes mellitus is quite confusing sometimes because it's composed of combination codes. So when we say combination codes, as I mentioned in our general coding guidelines, it is a combination of two conditions. It is a combination of a condition plus manifestation, or a combination of a condition plus the underlying conditions. So when we talking about diabetes mellitus codes, it is a combination codes that includes three main things. So number one, it involves the type of the diabetes mellitus. So when we are talking about type of diabetes mellitus, remember we have type 1 diabetes mellitus. We also have type 2 diabetes mellitus. So we will discuss this further as we go through our discussions. Okay, so the next one is the body system affected. So remember, when a patient suffers the diabetes, a complication may come in. So, and the complication may be resulted in like it affects the eyes, or it may affect the kidneys, like that. So it is specific to body system chapter, or the body system affected. So you need to specify what is the body system affected, because remember, diabetes mellitus is throughout the body because it involves the blood circulation. It affects the blood circulations because of your blood, okay, contains a lot of sugar already. And the number 3 is the complication affecting the body system. So when we go to the body system, it is specified what type of complication in that body system. It's not enough that you will going to code only the body system affected. You also need to specify what type of complication affecting that body system. So remember, we do not have 3 codes here. We only have one code because it's a combination codes. So in a single diabetes mellitus code, we will be now describing the type, the body system affected, and the complications affecting the body system. Okay, and the sequencing should base on the reason for a particular encounter. So again, our principle, most of the time, your first listed diagnosis should always be the reason for encounter or the focus of treatment. Now, in the diabetes mellitus, it composed of 5 categories. So assign as many codes from categories E08 to E13. Sir, there are for if it's for E08 to E13, meaning E08, E09, E10, E11. Do we have E12? We don't have E12, and we have E13. That's why it's only 5 categories, because we don't have E12. So we have E08, E09, E10, E11, and E13, as needed to identify all the associated conditions that the patient has. Now, the challenging one here is, what category should you use when you are coding diabetes mellitus, because most of the time they have the same they have the same description. The only difference it is the cause of the diabetes mellitus. It's very important that you know the difference between E08, E09, E10, E11, and E13. Okay, so I have an example of a diabetes mellitus codes here. So for example, let's have E10.311 type 1. So we are specifying the type. And we have diabetic retinopathy, meaning we're talking about the eyes. And the complication is retinopathy with macular edema. E10.3399 type 1 with moderate non-proliferative diabetic retinopathy. We're talking about the eye itself. Okay, so those are common examples. So as you can see, there are 7 character codes in your example number 2. So meaning, a diabetes mellitus code can be up to 7 character codes. Okay? But keep in mind, even if it's a combination code, if that combination code will not going to identify the whole scenario, you still need to add an additional code as needed. Okay, so I'm not saying that since it's already a combination code, you only need to use the diabetes mellitus codes. You are allowed to use an additional codes depending on the scenario, or if it's as needed, or if it's specified or instructed by your tabular list. Okay, so let's move on to your type, since we're talking about the type. So based on your example, based on the guideline that we have a while ago, we need to know the type. So we have type 1. Okay, the age of the patient is not the sole determining factor that most type 1 diabetes develop the condition before reaching puberty. So this is what we call the juvenile diabetes. I mean, since born, the baby or the newborn already have a diabetes mellitus, or it may happen before reaching puberty. So that is a common type, which is your type 1 diabetes mellitus. But as per your guideline, the age is no longer the sole determining factor, because sometimes you can have a type 1 even if you're already if you already reached the puberty, or you're older than your puberty age. It can happen. So for this reason, type 1 diabetes mellitus, also referred to as a juvenile diabetes mellitus. Okay? But it's not that common most of the time. The most common type of diabetes mellitus is your type 2. Your type 2 diabetes mellitus is due to your lifestyle. Okay, so most of the time, diabetes mellitus may happen due to morbid obesity, like that. So there's a predisposing or precipitating factors that may cause or may result into your type 2 diabetes mellitus. The problem here is from the type 2 results from insulin resistance with a defect in the compensatory insulin secretion. So the problem here is you have a lot of glucose, however your insulin is no longer there's a resistance of insulin resistance with a defect in the compensatory insulin secretion. So there's a problem with your transport of your glucose through the blood. Remember, our medium in order for us to absorb glucose is the insulin. Now, if there's a problem in the absorption of glucose via the insulin, it may result to your type 2 diabetes mellitus. Okay? And it's the most common type of diabetes mellitus. Okay, keep in mind, if you encounter type 1, your code for type 1 diabetes mellitus is E10. Keep in mind. I have 5 categories, remember? E08, E09, E10, E11, and E13. When we are talking about type 1, keep in mind, write in your book, when you're talking about type 1, your category should be E10. Okay, so every time you see a type 1 indicated in the scenario, automatic that the category should be E10. If you see E11, if you see E12, E13 rather, if you see E08, and if you see E09, eliminate that one. Because when you see a type 1, it is automatically E10. Okay, next, type 2. When you're talking about type 2, your category should be E11. Okay? E11. Now, what if there's no indication of a type of diabetes mellitus? But keep in mind first that when we're talking about type 2, it should be E11. So what if, sir, there's no specification of what type of diabetes mellitus it is? Okay, so let's have the next guideline. Type of diabetes mellitus not documented. So what if the diabetes mellitus type is not documented in the medical record? So as per your guideline, if a type of diabetes mellitus is not documented in the medical record, the default is E11. Type 2 diabetes mellitus. So keep in mind that your default is type 2. If you see the word type 1, it's E10. If you see the word type 2, it's E11. Now, if there's no specification of what type of diabetes mellitus, yes, you may use type 2, E11, but keep in mind that E08, E09, and E13 is not specified also most of the time. So you cannot go directly use E11. Although, if it's not E08, it's not E09, it's not E13, your default code should be E11. Type 2 diabetes mellitus. Why is it that default? Because it is the most common cases that we have. Remember, we are only using defaults if those are the most common cases that we have. Okay, next. Diabetes mellitus and the use of insulin and oral hypoglycemics. So sometimes when the patient suffered may have a diabetes mellitus, remember that we need to have a maintenance. So it can be an insulin injection, lifetime, or it can be an oral hypoglycemics. So an example of oral hypoglycemics can be your metformin. Okay, that's the common oral hypoglycemics. Okay, so if the documentation in the medical record does not indicate the type of diabetes mellitus codes and indicate that the patient uses insulin, code E11 type 2 because that is our default, and an additional code should be assigned from category Z79 to identify the long-term use of insulin and an oral hypoglycemics. Z79.84 to be exact for oral hypoglycemics. Z79.4 to be exact for your insulin, long-term use of insulin injections. So if the patient is treated with both oral medications and insulin, only code for the long-term use of insulin should be assigned. So see, in our discussion here, we're talking about insulin and oral hypoglycemics. So if the patient is suffering type 2, guys, most of the time type 2 uses C7, your long-term use of insulin and oral hypoglycemics. Okay, so if you see the scenario most of the time, if you see the use of oral hypoglycemics or the use of long-term use of insulin, that is usually your type 2 diabetes mellitus. And there are two types, like if the patient's only using oral hypoglycemics, that is Z79.84. But if the patient is using a long-term use of insulin injection, it is Z79.4. But so what if it's a combination? Like the patient is using oral hypoglycemics, long-term use of oral hypoglycemics, and the patients also suffer using a long-term use of insulin. So as per your guideline, if the patient is treated with both oral and insulin, only the code for long-term current use of insulin should be assigned. So eliminate the oral hypoglycemics. Only use your Z79.4. But as a reminder, code Z79.4 should not be assigned if insulin is given temporarily. Because remember, the definition of your Z79.4 is long-term use of insulin. It's not for temporary use only. Hope that's clear with you. Do you have any questions? Okay, comment down below if you have any questions. Okay, number 5. Guys, keep in mind that they love to ask questions about complications due to insulin pump malfunction. So it's very important to write the sequencing in your book. Okay, as my tip to all of you, always write the sequencing right beside the guideline. All the sequencing, remember I'm highlighting the sequencing on all my slide right beside your guideline, so that you don't need to read the guideline anymore, because you already have the sequencing there. It's very easy, it's very helpful during the exam, because remember, it's time pressured exam. Now, let's go back to the discussion about insulin pump malfunction. So remember, we have this insulin pump, okay, because it's really hassle to inject most of time to time your insulin, especially if you're using a long-term use of insulin. So it's a programmable pump that you can program it that it should inject a certain amount before this, in this time, before you eat or after you eat, like that. So remember, when we are talking about machine, or in any machine that we have, the common complication there, it is your malfunction. Obviously, a machine can suffer malfunction. Now, if there's a malfunction of your insulin pump, there are two complications that may happen. If either there is an underdose of insulin, the amount of insulin injected is not that enough. It is not based on the allowed, or it's not based on the programmed amount that should be injected. So the first complication is your underdosing. And another thing, the opposite should be overdosing or overdose. Okay? So keep in mind, if it's an underdosing, the first code should be T85.6. Mechanical complication. There's an additional code there. There should be mechanical complication of other specified internal and external prosthetic devices, implants, and grafts, followed by your underdosing code, and followed by your diabetes mellitus codes. Okay. That is exactly the sequencing. If we're talking about, they have the same sequencing with overdose rather, but it's the difference only is your second code. It's still T38, but I think it's T3X6 for underdosing, 3X1 for overdose. Okay, overdosing of insulin, or overdose of insulin due to insulin pump failure rather. So we have T85.6 is still, T38, 3X1, remember? X6 for underdosing, and still your DM codes. Just write that sequencing there right beside your guideline in order for you not to forget during the exam. Okay? Next. Okay, so we're done with E10. We're done with E11. Now, we are now on the other three types of diabetes mellitus. We have E08, diabetes mellitus due to underlying condition. You can go to your book. You can go to category E08. There is an instructional note there that when you go to your E08 category, you always need to code first the underlying condition. Meaning, As per the definition itself, secondary diabetes mellitus, E08, the patient suffered a diabetes mellitus due to any underlying conditions. Like, for example, if there is, if there's a cancer in the pancreas, so remember your pancreas releases insulin, produces insulin rather, that is very important in the absorption of glucose. So if there's a malignancy in your pancreas, it may affect the release of insulin or the production of insulin, and it may cause diabetes mellitus. And that diabetes mellitus is considered secondary diabetes mellitus because it is caused by an underlying conditions. So remember, every time you see a scenario that a condition is a result of an underlying condition, the underlying condition should be sequenced first. So meaning, put a note in your E08, it is always a secondary code. E10 and E11, they should always be a primary code. Okay? Except for insulin pump malfunction. That's very important. E10 and E11 is always a primary code, except for insulin pump malfunctions. For E08, it is always excuse me. E08 is always a secondary condition. A secondary code rather. E09 is drugs or chemical induced diabetes mellitus. E09 is a result of a drugs, okay, chemically induced, or a result of your overdosing and underdosing of drugs. Okay, your E09 can be a primary, can be a secondary, depending if you are talking about overdosing. E09 should be, if we're talking about overdose, E09 is a secondary. If we're talking about underdosing, E09 is the primary. Since we're talking about drugs here. Okay? So E09, it can be a primary or it can be a secondary code. Okay? Because it depends on the guideline of underdosing and overdosing. Okay? We will definitely discuss your drugs or chemicals, overdosing, and underdosing in your chapter 19 of your chapter specific coding guidelines. Next, we have E13, other specified diabetes mellitus. It is always a secondary code. They can never be a primary because your E13 is always caused by another conditions or event. Okay? It only happens due to another condition or event. So the common example there, if like for example the patients undergo pancreatectomy. Okay, so this is a common example. Secondary diabetes mellitus and the use of insulin oral hypoglycemics. We're done with this. The use of Z79.4 and Z79.84. Here's it. Assigning codes and sequencing secondary. So based on the tabular list instruction, E08, I discussed this as always a secondary. E09 can be a primary or it can be a secondary. Okay? If it's a poisoning, E09 is secondary. If it is an adverse effect or underdosing, it should be E09 first. Okay? Here's what I'm talking about. Your pancreatectomy. Okay? So E13. If it is due to removal of your pancreas or pancreatectomy, it should be coded under E89.1 first, followed by E13. E13 can never be a primary. So that's why, as you can see in the sequencing, it's only a second code. Z90.4 if an acquired absence of pancreas. You may also use then Z79.4 if the patients are already using your insulin, your long-term use of insulin. And that is most of the time it happens because you no longer have your pancreas. Okay? Secondary diabetes mellitus due to drugs. It can be an adverse effect or it can be a poisoning. We will definitely discuss this when we go to your chapter 19. So I have an example here in your um before moving on to the example, I just need to go through the summary. Okay, so when we're talking about diabetes mellitus, we need to know the type, the combination code most of the type of diabetes mellitus, the body system affected, and the complications in that body system. Okay, remember that we have 5 categories of your diabetes mellitus codes. You have your E08, and E08 can never be a primary, it's always a secondary, and you always to code first the underlying condition. E09 is due to drug or chemical, and your E09 can be a primary or it can be a secondary. Okay, so depending if it's poisoning or adverse effect. Okay, the third one is your E10, it's your type 1. When every time you see a scenario is your type 1, it is E10. It is next one is your type 2, which is your E11. That is our default code or default type if it's not specified in this scenario. And the long-term use of insulin and oral hypoglycemics. You also have your E13. That is due to certain scenario or certain conditions or event, like for example, the removal of your pancreas. Okay, the very important guideline that you need to know is your complications or insulin pump malfunction or insulin pump failure. That there's a 2 cases that may happen. It can be your underdosing and it can be your overdosing. So your first listed codes should be T85.6 most of the time, and then T38, and then the DM codes. Okay, keep in mind those guidelines. So I have an example here. A patient is treated for diabetes due to his chronic kidney disease. The patient uses insulin routinely. What ICD-10-CM codes are reported? So based on this example and based on the guideline, please comment down below your answer, and then I will definitely send you the rationale and the correct answer. Okay? So that ends our chapter 4. Up next, I'll be discussing chapter 5 and chapter 6. Stay tuned and happy coding.